coronary circulation. Now, everyone knows that the name of the artery which will be supplying the blood to your heart will be your coronary arteries. And coronary arteries will be actually two in number. One will be the right coronary artery and another one will be the left coronary artery, guys. So let's start again from the scratch. Heart will be supplied by coronary arteries. There will be two of them, right and left. First, let me teach you the origin of these two coronary arteries. From where are they going to begin? The origin. You got to remember that both the coronary arteries are going to begin from aortic sinuses. This is the golden word that you have to remember always, guys. So, coronary arteries are going to begin from where? They are going to begin from aortic sinuses. Now, these aortic sinuses, there will be one anterior aortic sinus. But remember, there will be like two posterior aortic sinuses. Okay, so there will be one anterior aortic sinus and then there will be two posterior aortic sinus. So, because there are two posterior, those two posterior aortic sinuses are divided into one will be the right posterior, another one will be the left posterior aortic sinus. And you all know very well how to read my tables. Read it from below completely. So one is your anterior aortic sinus. Read the name completely, guys. Try to learn it like this. Anterior aortic sinus. And then there will be a right posterior aortic sinus. And then there will be left posterior aortic sinus. Okay. Now from the anterior aortic sinus begins or originates your right coronary artery. That is the right coronary artery beginning from anterior aortic sinus. And then the left posterior aortic sinus, that is the one from where begins the left coronary artery. Left posterior aortic sinus. From there begins the left coronary artery. And remember, nothing will be coming from the right posterior aortic sinus. It is actually a non-coronary sinus. Non-coronary sinus, guys. So most importantly, focus on the origin of the right coronary artery and left coronary artery. Now some of the students will be like, sir, we have written the table, we have understood everything here in the notes. But the problem is, where do you have this aortic sinuses exactly? Exactly where do you find this? So remember, aortic sinuses will be present exactly at the very beginning of the ascending aorta. So we all know very well, ascending aorta will be beginning from the left ventricle. Out of the four chambers of the heart, from the left ventricle, ascending aorta begins. And just imagine in your mind the very beginning of the aorta, ascending aorta. So you just imagine my hand here. This is the very beginning of the ascending aorta here, sir. Understanding? So right in the front, there will be one anterior aortic sinus, okay, from where right coronary artery begins. And just behind that, you'll be having like two posterior aortic sinuses. There will be right posterior